Hello, my name is Aarya Ramprasad, and I will be presenting on behalf of my team for our poster named Utilizing the Novel Approach of the Anode Heal Effect to Minimize Interventional Radiologist Radiation Exposure. So, radiation has been used for imaging since the early 1900s, with continued efforts over the years towards solutions in mitigating the risk of radiation exposure. And so while we know that patients are at risk due to increasing use of imaging over the past 20 years, it's also important in that we consider the radiation exposure that many physicians experience. Interventional radiologists have limits that are set on radiation exposure, including an occupational limit of 50 MSV in 1 year and a lifetime limit of 10 MSV, multiplied by the individual's age in years to ensure long-term protection for them. New approaches to prevent radiation exposure include something called the anode heal effect. So within an X-ray tube, there's an anode and a cathode, which helps regulate the photons and electron beams. Photons are created deeper within the anode, which leads to less photons emitted from the actual surface. So based on the anode angle, source image receptor distance, and the anode angle, all of these variations can lead to a different amount of radiation emitted from the anode side compared to the cathode side. And so in this study, we aim to determine if the difference in radiation emission from the cathode versus anode side was recordable, and also discuss potential ways to implement this scientific phenomena into modern practice. So for our methodology, a dosimetry phantom alongside thermoluminescent dosimeters were used to record absorbed doses of radiation. Thermoluminescent dosimeters were placed by the thyroid for simulation purposes due to its radiosensitive status. Radiographs are recorded in the standard anterior-posterior projection manner. Recordings were completed twice, once with the phantom head placed towards the cathode end of the X-ray tube and once with the phantom head placed towards the anode side of the X-ray tube. These recordings were completed 5 times on each side to avoid any variation, and anode angle, SID, and field size were all kept constant throughout each trial to avoid variation. So for our results, we observed that there was a statistically different amount of radiation detected in the thyroid area based on the location of the anode and the cathode. With the anode placed towards the feet, or the opposite side of the thyroid, there was an average radiation dose of 1.254 mgy. While with the anode placed towards the thyroid, there was an average radiation dose of 0.835 mgy. So this led to a radiation dose received by the thyroid to be 33.41% less when the anode was placed near the thyroid/head. So based off these numbers, we can conclude that when the anode faces the thyroid, there is less radiation exposure, indicating that the cathode being placed near the subject of interest leads to a higher radiation exposure. So physicians such as interventional radiologists who are working on the side of the cathode could potentially have more indirect radiation exposure when working for prolonged periods of time, even if there is distance from the X-ray tube itself. We propose that by possibly covering the cathode side with a lead vest on top of a physician's recurrent use of lead gloves, thyroid protectors, radiation glasses, and other radiation protective gear while the machine is on but no patient is being imaged could reduce exposure. For example, with the C-arm X-ray machine, the diameter of the X-ray tube is so large that enforcing coverings of the cathode with lead or other radioprotective materials could help lead to a potential reduction in radiation exposure. This same principle can be used in patients by facing the patient's target tissue towards the anode side to prevent any excess radiation exposure. Physicians can also follow the rule that the higher intensity cathode should be placed on the densest part of the patient and vice versa for optimal protection from radiation. So further studies should definitely be completed to see if implementing this strategy that we have proposed could help provide long-term reductions of radiation exposure amongst physicians and possibly patients alike, with the goal of creating another standardized method of keeping people safe from the long-term effects of higher radiation exposure, especially over a prolonged period of time. Thank you so much for your attention, and I would love to take any questions that you have.